Everyone please take their seats. Well, good afternoon. I would like to acknowledge that the land we meet on today is the traditional land of the Kaurna people, and I recognise their continuing connection to the land, waters and culture. And we also acknowledge the Kaurna people as the traditional custodians of the Adelaide region, and we pay our respects to their elders past, present and emerging. I'd also like to thank our veterans, the women and men who have and who continue to serve our nation as members of the Australian Defence Force. Thank you for your service. I'd also like to thank the partners and families of our veterans. Without your support, our Defence Forces could not do what they do. Our women and men sign on the line, and you, as family members, are signed up as well. So thank you for your service and your support. I'm Catherine Walsh, I'm the Director of Veterans SA. I'd like to thank you for your interest in taking time to join us today. I'd also like to welcome our virtual attendees who are watching through the live stream. And this is a first for Veterans SA to ensure that information is widely accessible regardless of geography. Now, before I go any further, there always needs to be some important housekeeping. So virtual attendees, you can just get your cup of tea. We'll be back in a minute. So for all face-to-face attendees here today, our COVID Safe Plan. Now, if you have not already done so, can you please sign in? The book is where you entered today in the sort of breezeway area. And Paul, if you could put your hand up, please. Paul is the COVID Marshal, so behave. Bathrooms are located at the southern end of the building. For those who are currently challenged, that way is south. In case of an emergency, please exit via the doors that you opened today. Once you have exited the building, please assemble at the western end of the parade ground by the flagpole, closest to King William Road. So noting I'm pointing in two directions, you exit that way and then you stay on this end of the parade ground. Now, today's event will include a panel discussion on homelessness, a presentation from Wellbeing SA, and it will conclude with the Premier's third annual Town Hall meeting. Now, when you registered to attend today, you were asked to submit questions, and when you took your seat, you will see on each of your seats that you were supplied with a card and a COVID-safe pen, so you could write down your details and your questions that you can put to the Premier. And if you have more than one question, there are a few empty seats, so you can nab those cards as well. Now, we do this for two reasons. Now, your attendance today indicates that you're interested in matters affecting the veteran community, and by providing your details will enable us to update you on issues as they arise. Now, second, the Premier is a busy guy. Everybody here is busy as well, and so by providing your questions ahead of time ensures that we can get through as many of them as possible while we do have the Premier here today. Now, once you've written your questions down, if you'd like to raise your card in the air, and one of the Veterans SA staff members will collect your question. If you also have any questions during the day, during the afternoon, the team up the back corner, if you could stand, please, and put your arms up. Thank you. Then you can go to them for help, or the COVID Marshal. So without further ado, today we're privileged to have 5 leaders from the homelessness sector join us to discuss homelessness in South Australia. As I call each person up, if you would like to take a seat, this one here is mine, so you can choose from the other 5. So first of all, we have Ms. Linda Matthews, who's the CEO of Catherine House. Now, Catherine House offers crisis, longer-term accommodation and support services for women experiencing homelessness. We also have Mr. Chris Burns, who's the CEO of the Hutt Street Centre. The Hutt Street Centre aims to end homelessness for every person who walks through their doors. Among other things, they provide access to health professionals, training and employment programs. I'd also like to welcome Mr. Tom Wittenbury, who's the Service Manager from Street to Home. Street to Home is a housing-first approach supporting people sleeping rough in the Adelaide CBD, and they help them find and maintain affordable housing. Staff work in assertive outreach teams to establish relationships and pathways, and they also provide crisis assistance and primary health care. I'd also now like to introduce to the stage Mr. Ryan Olwitz, who's the Program Manager from the Andrew Russell Veteran Living Centre. Now, this is owned by RSL Care SA, and the Andrew Russell Veteran Living is designed for contemporary veterans who are homeless, at risk of homelessness, or who otherwise require accommodation and support to get back on their feet. And last but not least, I'd like to welcome to the stage Mr. Thomas Sutcliffe, who's the Assistant Director of Clinical Support in South Australia from Open Arms. In recent years, Open Arms has broadened the way they deliver services to the veteran community. They are working in partnership with key stakeholders in health, wellbeing and social support sectors of the broader community. So if you would join me in welcoming all 5 experts to the stage. Now can you hear? There we go. So I'm very conscious of time, that we have about 30 minutes for this presentation, for this Q&A. So I acknowledge that we're only going to really skate on the surface, but what I'm also really interested in doing is this is the start of a conversation. And if you're interested in hearing more from any of our experts, then we can always invite them back for a second panel which is more focused, or we will also on our website have details of how you can connect with each of these organisations, along with the recording of this panel presentation as well. So welcome everybody, and thank you so much for giving up your time to talk to us today about homelessness in South Australia. So I just have a couple of quick questions to sort of start off with, and I might start with you, Tom W, about Street to Home. And can you explain to us how Street to Home integrates with other services, being housing or other immediate needs across Adelaide?
Yeah, thank you. So Street to Home is funded by SAHA, the South Australian Housing Authority. So we provide assertive outreach. So we go out on the streets and work with rough sleepers, and then work with other agencies such as Hutt Street Centre, Catherine House, other government and non-government agencies to link those people into the appropriate service. So I guess the way we do that is, one of the big ways we do it is through the Adelaide Zero project, which is run through the Don Dunstan Foundation. So there's 40 different agencies, both government and non-government agencies, that sit on that. We have a coordinated care list, so looking at some of the most vulnerable people out on the streets in the city, how we're working as a multi-agency approach to support them, whether it be through mental health, physical health, it might be through getting them engaged back into employment and those sorts of things. We also have, I guess, a lot of informal and formal meetings with one another as services. Being quite a small industry and being Adelaide, a lot of people come from different agencies. So I've spent my last 6 years at Hutt Street and actually used to work with Chris. So I've just recently moved across to Nemai National, managing their Street to Home program. So yeah, I guess we work as a collaborative model really, so it stops the duplication of services that a client might have to go through.
Great, thanks Tom. And I guess a supplementary question to that is, with your, and this was one for you as well, Chris, is that how would Street to Home interface with somewhere like the Hutt Street Centre?
Yeah, well, we make sure, obviously, having a close working relationship. So I was down at Hutt Street only a couple of days ago, looking at how we can support, whether it's assisting with intake of people sleeping rough. We'll work with Hutt Street Centre in relation to letting people know out in the streets what Hutt Street Centre can provide. So obviously, you know, they have a great meal centre there. They have facilities such as showers and those sorts of things that rough sleepers can come in off the street, access those facilities, as well as, you know, nursing and GP services. So it's really important to us as a service to collaborate, because I guess what we want to do is reduce the client having to go from service to tell their story, which can obviously re-traumatise that person. So I guess we as a service want to do the legwork for that client, and yeah, collaboration's really where it's at.
Yeah, great. Thanks, Tom. Chris, do you have something to add?
Sure. I thought I'd just give a quick example of where we all worked together very, very quickly, and that was the outbreak of the COVID pandemic in March. At that time, we had registered 151 rough sleepers in the city of Adelaide, which was a pretty good stat at the time. And there was a realisation we had to get them off the streets because it was a global health crisis. And the government said, get them into hotels and motels. And it was almost like it had been drilled. We immediately reacted, and working together, our various organisations, in the space of 2 weeks, we got over 340 people accommodated in hotels and motels across South Australia. And then collectively we were able to care for those. Eventually it grew, there was 500 at various stages in those hotels and motels. So we have to work together collaboratively. We each provide a different range of services, and so no one organisation can provide the one full spectrum of services, so we have to work together, and we have to work together with the government as well.
Great. Excuse me. Thank you, gentlemen. Now, if I can go to you, Ryan. What we've just heard about is, is that Street to Home and Hutt Street Centre provide support to anybody who's a rough sleeper or is experiencing homelessness in South Australia, or certainly in the CBD. But the Andrew Russell Veteran Living Centre, that's specific for people who are current or former serving, isn't it?
Yeah, that's correct. So RSL Care, we provide both affordable and emergency accommodation. The emergency accommodation is located in Sturt. We have 10 units down there that RSL Care purchased back in 2017. It was a $1.6 million investment in bricks and mortar, specifically to address homeless veterans. From there, the program's been running for about 5 years now. We've provided 12,500 nights of accommodation to about 120 veterans. And they generally stay with us for 3 to 4 months, during which time we really focus on those housing pathways. So we're looking to work with them to find a permanent long-term solution that really suits their needs. So we focus on that bricks and mortar, but we really have that holistic view of their well-being as well. So we use the program as an intervention program through wraparound support services to address those issues that have resulted in the homelessness in the first place. We're quite assertive in this approach, and we find that veterans are quite stoic, can be very reluctant to ask for help, but when we provide it for them, the results are fantastic. So we work with Open Arms very closely. They provide our counselling support. We work with pop-up community care that provides in-house nursing care, and we link back to DVA for specific veteran matters such as payments or outstanding claims. We also work with a whole range of other ESOs, the Plimpton Veterans Centre, the RSLs for advocacy, financial counselling, really specific things to address those factors. So our view is bricks and mortar, that's what we do, and then we provide veterans with the services to address those underlying issues.
Great, thanks for that, Ryan. And that's a beautiful segue then to asking Tom S. About your, so you represent Open Arms, and you obviously have a relationship with the Andrew Russell Veteran Living, as we've just heard from Ryan, but I understand that you have a developing relationship with the Hutt Street Centre as well, which provides services for anybody experiencing homelessness, but your piece is around specifically supporting veterans.
Yeah, that's right. So the Aval Project is kind of got a pilot, was initiated by DVA and RSL Care, and we're very much part of that. But what we were finding was that we were delivering services to people who didn't perhaps quite fit in to that, to that criteria, because we'd also deal with veterans' families as well. So we were working together with places like the Hutt Street Centre, and we're finding that a lot of our client group were working with case coordinators from Hutt Street, and we were collaborating with them. So it seemed like a fairly natural step to liaise with the Hutt Street Centre and start looking at how we can develop services sort of more specifically for veterans. And I think Chris has sort of taken that further, and we're linking in DVA as well and sort of looking to provide a bit of an in-reach so that people who are accessing that service but might not necessarily identify as being eligible by not identifying as being a veteran or a family of, we can have a presence there and have a chat with people and maybe sort of a step up into services so they require.
Yeah, great. Thank you. And Chris, as the host, I guess, of the Open Arms outreach that Tom was just describing, how are you seeing that is having an effect on the people experiencing homelessness that you're supporting?
Sure. When I first started in the role, I met a gentleman who was a client, and I talked to him for a while. And it struck me that he was clearly a veteran, and I said, "You've served before, haven't you?" He said, "No, I haven't served." And it took a few conversations over a number of days that I finally worked out that he'd actually been a corporal in the army and had been an instructor at the Recruit Training Battalion. And I said to him, "Why don't you want to admit you have entitlements and what have you?" And he said, "I'm too proud." He said, "I don't. My mother lives in the hills and I've got 2 sons here in the city and I don't want them to know where I'm at." And he said, I don't know. I don't know if I'm entitled to any veterans entitlement." And that motivated me to say, well, what are we doing for our veterans and how are we helping those veterans who are homeless? And my first point was to go to the questionnaire we do with all our clients when they come in. And I said, "What question do you ask in relation to veterans?" "Oh, that's easy. Here's the question. Are you a veteran?" And I said, "Well, you just asked the worst question." Because most people, there are a lot of veterans who just don't believe they are veterans. So we have to change it to, have you served in the Australian Defence Force? And we've since added another question is, have you ever been a partner of or the child of someone who has served in the Australian Defence Force? So it's actually when you start going through that process, we started identifying there are a number of people who are homeless here in South Australia who either now self-admit or are potentially. But what we needed to do was find one point where they could come to and have access to the DVA, to have access to the Andrew Russell Centre, to have access to Open Arms. And so what we had at the Hutt Street Centre said is we will be that point and we will let it be known to all the agencies in the homeless community that if you have someone who you believe may be a veteran or the family of a veteran, send them to us, and then we are going to arrange that on certain days of the month. There will be people there to talk to them, determine their eligibility and trying to support them going forward. We have a by-name list of those registered in the city, and we've identified potentially 34 who we believe are living homeless, rough sleeping in the city, who are potentially veterans. So that's
Thank you, Chris. And just following on from the observation that you made around that the wrong question was being asked to start with, so you've changed that to being, have you had military service? But then the second one around, have you been a partner? I think that's a wonderful initiative, and is also part of the reason that we've invited Linda here today from Catherine House. When we called for questions ahead of today's town hall, there was a great deal of interest in recognising what is being done to support people who experience domestic violence, and certainly from our initial conversation, Linda, just before, you recognise that most women who come to Catherine House as a result of domestic violence. So would you be able to just explain to everybody in the audience, I suspect a number of us aren't familiar with what Catherine House provides?
Certainly, I'm happy to do that. Maybe you can hear me. We're right now. Let me know if you can't hear me. Every night in Catherine House, we accommodate 50 women. We have various programs that support women. Mostly have had some domestic violence in their background, but they also come to us for other reasons that led them into homelessness, and that is mental health issues, often untreated, sometimes as a result of domestic violence. And what goes with that often is they have drug and alcohol problems as well. This is also true for most of the homeless people, for men as well, but there are particular issues for women, mainly to do with safety. In fact, that was one of the big reasons that the Sisters of Mercy and Sister Anne Gregory in particular first started Catherine House 30 years ago, because she found women in boarding houses and rough sleeping and in other places where they were simply not safe. And we knew that that was very important. It was important then, and it's just as important today. We have 3 programs. One is our crisis program, and that's funded by the South Australian Housing Authority, and that has about 16 women, up to 16 women, and we house them for about 3 months. They can stay for up to 3 months. I have to say we're not particularly rigid necessarily about that time frame, because sometimes women need longer. with us. If they have mental health problems, we have a much longer term program for them as well, and they can stay for up to 2 years. We also have a permanent accommodation program, and this is for women who really can't live independently. These are women that once would have been institutionalised, and with the closing down of institutions, there are people that, there have been a lot of women and men, I should say as well, who found it difficult to adjust to be able to manage their lives without some fairly intensive support. We're really pleased since the National Disability Insurance Scheme came in that we're able to help more women in this program, and that's what we're attempting to do. We also have a women's centre where we provide part of our services wrap around and as holistic support as we can. And at that centre we have classes that, or supports that help build women's confidence, but we also have classes that help them get back into education if they've been disconnected, or for the first time they may be wanting to undertake a course, and it ranges from something very basic to university entrance. So we have quite a range of activities going on there. We also have other, we link them to other support services because we are not, we're not there to provide therapeutic services, although we end up doing that, of course. We link them into professional services. That ranges from medical practitioners through to psychological help to drug and alcohol services, and a whole range of other things as well. And what we've also learnt at Catherine House is that when women leave us, they need to be able to find a way to reconnect back with us. So we have an outreach service as well that women can use and call us if they think the issues that brought them to homelessness are recurring. Most commonly it'll be mental health issues or potentially drug and alcohol problems as well, that we can then help them, because the most important thing we can do is help them to sustain their housing so that they don't end up back into homelessness, and that's our big goal at Catherine House, to do that.
Thank you, Linda. And noting that sustainable long-term accommodation is the objective of everybody here on the panel, whether you directly or directly affect that or not. Ryan, you talked earlier around what the Aval does. Can you tell us about how Aval integrates with other accommodation options in SA to best meet the needs of veterans?
Absolutely. So we find that each veteran has a very diverse housing needs and wants. The majority of the veterans that come through Aval are transitionally homeless. So their needs are very different to a rough sleeper or a primary homeless person. So we find that 20% of the veterans that come out of our program are able to secure a private rental property. We will assist them in doing that. They have the financial resources and the capability of doing so, but we might pay a bond, or we might put some furniture in there, or give them a reference to help them along their way. Another 20% go into community or public housing. We have a MOU with Westside Housing to provide housing specifically for veterans. We work with a few other community housing providers in the state, and we're currently working with the Community Housing Association in Canberra to really open the doors up to the community housing program for veterans. We find this works very well for a veteran who is on a DVA in-cap payment or is unable to work. They need affordable, long-term housing, so community housing works really well. The other part of what we generally go for is within our own affordable living program. So we provide long-term stable leases owned by RSL Care. We also help the veteran maintain that tenancy. So we do social engagement activities, we offer community mental health and welfare checks, just to make sure that they are able to maintain that and they don't slide back into that homelessness. We find this really useful for a veteran who is able to live independently but just needs that extra bit of care from a veteran organisation where they don't quite suit community or public housing. So that's really the three main ones that we use. We've even used the full continuum of care from homelessness to a transitional accommodation into our own affordable, and then into one of our aged care facilities for the right veteran. So that's really what we do.
Great, thanks for that, Ryan. And just around terminology, you talked about transitional homelessness. So how is that defined?
So transitional is defined as anywhere under 4 weeks of experiencing homelessness. Then long term is from 4 weeks to 3 months, and 3 months is considered to be a chronic. 4 months. Anything over 4 months is considered to be chronic homelessness.
Right, and Tom W., you talked about rough sleepers. Can you help us understand what that means in light of Ryan's definitions as well?
Yeah, I guess rough sleeper is someone that you would see out in the parklands or you might see in the city or those sorts of things. So, I mean, homelessness can really be anyone with no fixed address. So someone who is couch surfing from going from place to place is considered homeless. But I guess rough sleepers, who obviously Hutt Street sees a lot of and Street to Home, that's who we're kind of, employed to engage with, is those people who are rough sleeping around the city. They can be well hidden, and that can be for a variety of reasons, their own safety, and a lot of the time they don't want to engage with service. So it's really to let them know that we are there to support them through that stage. So yeah, that's I guess what rough sleeping is.
Great, thanks for that, Tom, and thanks, Ryan. Linda, how do you explain the increase in homelessness for women currently being reported?
I think it's largely domestic violence that seems to drive it a lot. It's also what I talked about before, mental health and substance abuse, but we can't ever forget poverty. That's such a big driver. And I think there are particular issues for women. We've talked about housing affordability, which is an issue for everyone, for many households in South Australia and across the country are in household stress because they can't afford private rental income. But for women, it is particularly stark. For a number of reasons. One is their historical role as the main caregivers for children and now often for ageing parents. It means that they've earned a lot less income over their lifetimes, which leads often to a lower superannuation balance, so they don't have as much superannuation. They're much more reliant on welfare, Centrelink payments, and this is linked to their intermittent workforce participation as well. And for older women, this is like a double whammy. They often have not even understood being in superannuation. And you don't even have to be particularly poor to not understand that. I didn't join super till I was 40, which would be kind of unheard of for my children's age group. They join much younger, or they at least understand it. They know that it's available for them. It never occurred to me to join superannuation until somebody told me when I was that age. And of course, historically, as they're older, they expect a husband to take care of them. And with roles of women changing dramatically over the last 30 years, that is really less available. And of course, divorce and death of a spouse can change everything. Some of you might know that the fastest growing group of people divorcing are people over 50, and women are a large proportion of those who are instigating leaving a marriage after a long time. In fact, in Catherine House at the moment, we've got a woman who is 72 who's left a 40-year domestic violence relationship. So we are seeing more than that. And I think the COVID pandemic has exacerbated all of this happening, and we can see that at Catherine House. We expect there'll be a lot more demand for our service as more women become homeless.
Thank you, Linda. Now, I'm conscious of time and I'd like to give people the floor an opportunity to ask 1 or 2 questions at the end. So maybe, Chris, I can ask you the last question, which is, excuse me, what do you feel are the 2 greatest challenges or opportunities in the homelessness sector in 2021?
Sure. I'll give you a new concept. Putting a homeless person in a house does not end their homelessness. It takes a while for someone to feel safe, to feel at peace, to feel integrated into their community. And the concept we use is the concept of homefulness, which is the opposite of homelessness. And so that requires that just giving a person a house isn't the solution. You have to case manage them and support them through to the point where they never need your services again. I'll just give one challenge if I can. The challenge we are experiencing at the moment is many of our rough sleepers were housed as a consequence of COVID, and that was a great thing. Over 200 were housed. We're almost back up to our pre-COVID level now of rough sleepers, but a large proportion of them are new clients, people we have never seen before. And you can see the fear in the eyes when they try to walk, when they eventually come to our door. They're scared. They don't know how it is they've got to the point where they have to need our service, and they don't know what their future is. Within that cohort of new clients we're seeing, they're younger, they're far better educated, they're recently employed, and a higher proportion of them are females. And they are traditionally now, not traditionally, but they are coming out of the hospitality and the retail sector. They were part-time or casual, and they've got to the point where either the business failed and they became unemployed and couldn't pay their rent, or there are employers now who are anticipating the wind back of JobKeeper and are shredding staff already. And when you've been a part-time or casual employee, just barely paying the rent on your house, and you lose your income, they're finding out the only place they can come is to our homelessness services. The challenge that we have is already in this first third of this financial year, we have seen half the number that we saw last year. So our numbers are already up. We're about to go into our peak period, which is December and January, where we expect to see higher numbers coming through. But our line in the sand is the 28th of March next year. And that's when JobKeeper ends, JobSeeker reverts, the restrictions on evictions are lifted, the bank honeymoon on mortgages will be eliminated and people will have to pay back their mortgages, and landlords will be demanding their back payment of rent. So we are challenged by what we perceive is almost a second wave of poverty and homelessness in the first quarter of next year. And our challenge is how do we respond to that going forward? The opportunity that we see is how do we switch the culture from that, get them into a house as quick as possible and you'll end their homelessness. How do we stop them becoming homeless from the outset? And that's about a community caring for people. And when you see someone who is struggling, and if you see someone who is having difficulty paying their rent, how do we help them to pay their rent, to stay in their tenancy so they don't have to become homeless? Because it is a far cheaper concept to keep a person in a tenancy than to try and help them once they have become homeless. So we're not through the COVID crisis from our perspective yet, and we are looking at a challenging first quarter next year. So if you keep that in the back of your mind, anything you can do to help would be greatly appreciated.
Thanks for that, Chris. Now, as I said at the top of the conversation, we're not even going to scratch the surface, but this is an introduction at least to some of the services and supports that are available in South Australia for veterans and families. You do have your question cards, so if you want to fill those out, we're happy to take them on notice and make sure that those questions are answered, and we'll be publishing them on our website. But if the panel's okay to stay up for a couple more minutes, maybe we could take 2 questions. Yep. Neil. Sorry, a microphone's coming. It's for our live streaming people. I'm sure you've got a good projection voice.
Hi guys, do you hear me right? Yep. All right, thanks for coming, introducing yourselves. I had a question for Ryan and Tom. So what do both of your respected organisations plan on doing to help those high-risk veterans that you've previously deemed too hard and turn away from both of your organisations?
I can take this one. Absolutely, and you're right. There are pockets of the veteran community that present with very complex needs, and some of them don't suit the program that we offer. In the past, we have learnt some pretty significant lessons that offering services that we can't actually achieve is a detriment to the veteran. It's a detriment to other veterans in the organisation. So we take a very holistic approach, and unfortunately there is veterans who we're unable to assist. That said, our answer is never no. So we will always direct a veteran with very complex needs towards the service that is more appropriate for them. So whether that is a substance or alcohol rehabilitation facility, whether that's the Jamie Larkham Centre for some mental health treatment, or there's a whole range of other organisations out there, and we will direct them towards them. Do you want to add something, Tom?
Yeah, so thanks for the question. I guess would never say no to providing a veteran a service. It might be that they don't meet some eligibility for certain aspects of the service for a number of different reasons, but we're always willing to help where we can. And so I think that, just like Ryan said, it might not be that our service is the most appropriate to provide the primary care or be the lead agency in treatment, but we can help support that veteran to those places, where they want to and where they're able to.
Can I just add, if I've got 2 seconds, just to add a quick little case study around that exact scenario. Earlier on the year, we had a veteran come to us who had been evicted from his accommodation due to his alcohol use. He wasn't able to function independently. He was sleeping rough and he came to us. Initially, we denied his application for housing. Open Arms provided some emergency accommodation for him. Within 3 days, we arranged for a DVA white card approval and approval for him to move into substance treatment. He spent 3 months in alcohol rehabilitation, knowing that once he completed that program, he would come into our Aval Accommodation. We worked with him. He's now in a community house. He's back in the workforce. He's an absolute changed man. So if we'd offered him housing initially, we would have exacerbated that condition and made it worse. So we intervened. DVA and Open Arms helped with that, and the outcome was far better. So that's the process we use.
Great, thanks for illustrating that, Ryan, and thanks, Tom. I'm getting the wind up, but I will take one more question, if there's one more. Yes.
Just a very broad understanding of how many homeless veterans we talk about in South Australia. It's pretty broad and rough.
So you mean
Give me a number. How many we got in Adelaide floating around?
homeless veterans? Yep.
Probably Chris is probably in the best place to answer that one.
Yeah, look, we think on the register that we've gone through, there's probably 30 to 40 here in the Adelaide CBD, and if you probably multiply that by 4, that's probably what's in South Australia, that are actually sleeping rough. Then there are those that are couch surfing, there are those that are sleeping in boarding houses, and those that are not sleeping in what we would deem as good suitable accommodation. So the total number of homeless people in all that categories is 6,000 in South Australia. And I wouldn't be surprised if in the veterans world we represent about maybe 5% of that.
It's very difficult. Great question. We'd love to have an answer for you. It's very difficult because of that broad definition of homelessness. Perspective, we had 85 inquiries for emergency accommodation in the past 12 months. So it really ranges from that transitional right to that chronic spectrum of homelessness. So yeah, it's a very difficult answer to provide, sorry.
Great. Well, thank you. So that is our time for the panel. So thank you, panel, and you're invited to stay for the rest of the afternoon. As I mentioned, this was just a quick introduction by some of the experts in our homelessness sector. Veterans SA is happy to receive questions if you've written them on your card or before you go today. The team up the back will take them. And for those who are watching us on our live stream, you can email us, which is veteranssa@sa.gov.au. We chose, just to give some context, we chose the homelessness as the topic for the panel today because that was based on overwhelming feedback from the community. There were also a number of other topics that we received a lot of interest in as well. So we're actually looking to build up an education series for next year on a monthly basis. So if you'd like to hear more about veteran homelessness or about any other topics, again, please write that on your card or email us on veteranssa@sa.gov.au. So on that note, if you will join me after I've said everybody's names and thank Chris Burns, Linda Matthews, Tom Wittenbury, Ryan Olwitz and Thomas Sutcliffe. So thank you for joining us today. So I'd now like to introduce Miss Lyndall Thomas from Wellbeing SA. Lyndall is the Acting Manager of the Partnerships and Programs team. Now, Wellbeing SA is an agency under the Minister for Health and Wellbeing. It was established as an election commitment to rebalance the health system and shift the focus from treating illness to promoting physical and mental health and wellbeing. You'll find some material from Wellbeing SA as well as other useful information from other organisations in the bags that were placed on your seats. Now, Lyndall is here today to speak about some of the programs that are available to all members of the South Australian community to assist in living a healthy and well-balanced life. And now these are helpful for members of the veteran community who may not be eligible for any DVA programs, or to augment those that you are eligible for from DVA. So without further ado, I welcome Lyndall to the microphone. Thank you.
Good afternoon, everybody. Thank you to Veterans SA for inviting me along to speak to you today. I also want to acknowledge that we're meeting on the land of the Kaurna people and that we recognise their ongoing connection with the land. And I'd also like to thank our veterans and current serving personnel for the great work that they do in our community. So following on from that introduction, I do work in Wellbeing SA in the Prevention and Population Health Directorate, and our work is very much focused on helping people to be as healthy as they can, trying to reduce their risks for developing chronic diseases such as cardiovascular disease and diabetes. We have a lot of work focused on preventing and managing obesity. But we also work around policies, work across government. We collect a lot of data so that we can track what's going on with people's health, so we can guide the work that we do from that perspective. We do provide some programs that are available across the state or for specific groups of people, but before anybody can really do anything to improve their health, they really have to understand what it is that they need to do. So I thought I might just give you a quick 101 on healthy lifestyles. Where I work, we very much focus on the SNAPS risk factors. So that's smoking, nutrition, alcohol, physical activity and sleep. So those 5 risk factors are the major preventable causes of heart disease, diabetes, obesity and quite a number of cancers. So firstly, smoking. Absolutely, the best thing you can still do for your health is to quit smoking. It's not now probably the biggest cause of preventable death. I think obesity is probably past that now, but it's still up there, and absolutely quit smoking. And of course, I hope you're all familiar with the Quit line. That's one of the best supports going. They have counselling services there that are free. Otherwise, talk to your GP, access nicotine replacement therapy, whether it's patches or medication, or talk to a pharmacy and maybe purchase some gum. Alcohol, again, it's, bad for your physical and mental health. Alcohol consumption across South Australia actually is lower than it was years ago, but many people still drink more than what is good for their health. It's closely linked to a range of cancers, particularly cancers of the stomach and the mouth and esophagus and those sorts of areas. And drinking to intoxication is one of the primary causes of accidents and violence. Cutting down, it's great for your health. You don't necessarily have to stop altogether, but for some people that is, of course, the only option. Drug and Alcohol Services South Australia, which is funded by, as part of SA Health, they provide the ADIS service, Alcohol and Drug Information Service. Through them you can access telephone counselling, but they can also work with you to link you into other clinical services, whether they're community-based or inpatient services, rehabilitation programs, that kind of thing. And again, don't forget your GP can be very helpful. Nutrition. Eating a healthy diet, it's very important, and a poor diet is probably the major contributor to being overweight or obese. So it's a really big focus area for the work that we're doing in Wellbeing SA. There are national guidelines around what you should eat to maximise your health benefits. But some simple advice just quickly is eat more fresh fruit and vegetables and try to avoid packaged and highly processed food. Eat less sugar, salt and fat. And one of the ways to achieve that is to eat more fresh fruit and vegetables and avoid highly processed and packaged foods. Drink more water, so try to avoid soft drinks, too much alcohol, fruit juice, flavoured milk, energy drinks, all of those things that are absolutely chock-a-block of sugar. Avoid fad diets if you possibly can, particularly any diets that cut out whole food groups or really restrict how much you can eat or just sound like they might be quite wacky. And try to eat regular meals and snack less. The guidelines also talk about how much to eat, and if you eat too much, doesn't even matter if it is healthy food, you'll still put on weight. It's all about balance, energy in, energy used. So think about that, and there is a brochure in the pack of information, so that's a good place for you to start as well. Again, talk to your GP, have a health check. Weight Watchers is a really good service. Find a dietitian through one of your services if you possibly can, or if not, use the Get Healthy service, which is a telephone service we provide, and I'll talk to you some more about that later. Physical activity, being active every day is really important to maintain your health in lots of ways. We recommend 30 minutes of moderate activity. So moderate activity is like walking that increases your heart rate. So not the kind of walking where you're just going from the fridge to the couch. Track it if you can. If you don't have one of these wonderful little devices, most modern phones will track your activity. If your goal is to lose weight, you're going to have to do a lot more than 30 minutes a day. You're going to have to do vigorous exercise and at least 60 minutes or more a day. It is really hard to lose weight, but it is possible, and you just have to do a combination of healthy diet, being active, and keep at it. We also try to encourage people to do resistance and weight and balance. All of those things, especially as you get older, balance is really important to prevent you from falls. And people presenting to falls in our public hospitals far outweigh the number of people who present from car accidents. It's a huge burden on our health systems. Older people often, following a fall, are never able to return to home and live independently. So whatever you can do to keep yourself physically active and strong is really important as you age. So again, the same sorts of information for things that you can do. Talk to your GP, get a referral if you can to an exercise physiologist or a physio who can work with you, do a proper assessment and make recommendations about the sorts of activities and exercises that are safe for you to do. Start slowly and build up and keep track, and that way you know that you're doing better all the time. And most importantly, if you can find someone else to do it and do something that you enjoy, so whether it's playing tennis or throwing the frisbee with the kids or golf or swimming or cycling, do whatever you can, do it with someone else if possible, and make sure it's fun as well, and that way it's easier to keep going. And so the last of those risk factors is sleep, and I think it's something that has often not been talked about enough. It's really important for your mental health as well as your physical health, and maybe you've heard about the links between sleep and mental health before, but less so in relation to your physical health. But while you're asleep, all kinds of physiological, biological, hormonal, endocrinological, I can't even say that word, processes are happening while you're asleep. Our whole body, despite all the bright lights and the way we live these days, is actually biologically programmed to be asleep at night and awake during the day. So, for example, shift workers, and I bet among veterans you've all had your turns at working all night and all of that kind of stuff. It's actually really bad for your health, so you have to try as best to manage those things. There are some sort of simple advice about try to have regular routines, try to get at least 7 to 8 hours of sleep a day. If you do have trouble sleeping, minimise caffeine, alcohol, things like that, too close to bedtime. You know, keep the bedroom for sleeping. Don't watch the television and play games on your phone and all of that kind of stuff in bed, because your brain makes these connections between what you're doing in your environment and kind of disrupts that idea that I'm in bed, I should actually be trying to be asleep. And the other thing, many of you have probably heard of sleep apnea. Some of you will have it and not know that you have it, and unless you listen to what your partner tells you about the funny noises that you make at night, you won't be aware. And if your partner does tell you, take notice. Sleep apnea can be quite dangerous. It's really bad for your health. It contributes to the development and poor management of diabetes and heart disease and other illnesses. But it can be managed. There are services provided by SA Health, but you do need a referral from a GP. Talk to your psychologist. Maybe Open Arms has people that could help you with improving your sleep. But don't forget, it is really important, and it is as important as eating well and being active. But just moving on, to talk about some of the services that are available, there are some free things, and I've already referred to two of them. So the Quit line, it's free, it's available to anybody, you only have to call. You can find information also from their website, but they're a great service. But don't forget, smoking is really hard to quit, and don't give up. I think the statistics say about on average 12 tries to be successful and completely stop forever. So, you know, never give up, just have another go. Addis, I've also already mentioned, that's provided by Drug and Alcohol Services, and they will link you into clinical services and supports if you need them, but otherwise they have a telephone coaching or counselling service that you can speak to people about the sorts of changes that you might be able to undertake yourself without any particular professional support. We fund a program that Council on the Ageing delivers called Strength for Life. It's a strength and balance program. I actually go myself. It's for people who are over 50 or Aboriginal people who are aged over 40, and it is exactly what it is. As it's called, it's to help people maintain their strength and balance as they get older, to reduce their risk of falls. But as I said to you earlier, remaining strong muscles and bones help you stay upright, help you be active, help you run around after the grandchildren without falling over. So I would highly recommend that program. It isn't free, unfortunately, but the cost is kept to a minimum. It's available in about 95 locations around the state. So if you go to the COTA website, you'll be able to find where the nearest program is for you. I think it's a great program, and as I say, we've been funding it ever since it started, so about 18 years now. So highly recommend that for the older folk here today. At the moment, Wellbeing SA has a 1 billion steps challenge. So if you feel like doing a little bit of walking and keeping track of that walking, you can log on to that and help contribute to the state achieving 1 billion steps. That is, of course, free to enter. And we've got to more than halfway in just over a month. So we're pretty happy with that. But once that's all over, you will still be able to log into the 10,000 steps program. And as I said earlier, keeping track of what you do is really quite important, and it's quite a good motivator to see, oh, I didn't do quite as many as yesterday. And if you really are trying to build up what you do, well, you do need to keep track so that you know. And I mean, after a while, you get a general sense of how many steps you get if you go for a half-hour walk. But the 1 billion steps and the 10,000 steps, you can also record other activity as well. So whether it's an hour's worth of cycling or you know, working out at the gym, going for a swim, whatever, you can include those things as well. But The program that I probably wanted to talk to you mostly about is the Get Healthy service. It's a telephone coaching service. It's a bit like the Quit line, except that the focus is on healthy eating, being active and managing weight. The coaches are all professionals, so they're nurses, exercise physiologists, dietitians, people like that. When you enrol in the program, you are assigned to a coach who works with you across the whole 6 months that you can be in the program. And primarily what they do is talk to you about the process of how to make change. So they will talk to you about what it is you want to try to do to improve your health. Do you need to eat a healthier diet? Do you need to be more active? And they will work through that process of identifying clearly what your goal is, what actions you can undertake to try to achieve those goals, and they will work around those SMART goals that are specific and measurable and achievable and time limited. So that idea of baby steps, and when you've met that first little goal, move on to the next one. They'll talk to you regularly over the 6 months, helping you to keep on track, so that if your goal was to eat, 3 more serves of vegetables this week and all you managed to achieve was 3 more serves of Maccas, they'll talk to you about that and, get over it, move on, don't worry about it, let's review your goal, have another go. So very much focused on motivation and keeping people engaged in the program so that they can keep going. Because as I've said, and I will keep saying, making change, particularly around these kinds of behaviours and habits, it's really, really hard. You have to stick to it, you have to admit, I messed up this week because I had a really bad day and I bought a block of chocolate on the way home from work. Just move on, forget about it, go back, think about your goal, keep moving. And the Get Healthy service is really great at helping people to do that. You can have 10 calls over a 6-month period. If you want to, when you're finished, you can re-enrol and start again. At the end of the 6 months, if you want, there's an SMS follow-up service where they will send you messages at a frequency that suits you, whether it's once a week or once a day, about the goals that you were working towards and want to continue towards. So you continue to get that little bit of a reminder about how are things going, and you, of course, can go back into the program again if you want to. There is a module for people who are at higher risk of developing type 2 diabetes, and those people will receive additional calls to the standard 10. And there's also, we've recently introduced a brief intervention module for people to help them reduce their alcohol. So on the basis of the screening that they do at the beginning, if they think you've answered questions in a way that indicate that you drink more than is good for your health, they will offer that brief intervention. And after you've had 4 or 5 calls around alcohol, then you will move back into the main program that will focus more on your diet and being active. So they're the things that we provide, but there are all kinds of other programs out there that are available to anybody, whether you're a veteran, whether you're young, whether you're old, all kinds of things. Local governments are a really great source of services. They have lots of free programs, cheap programs. They support sporting clubs. They have community gardens where you can go along and grow some vegetables for yourself, and there might be some cooking programs there. The Heart Foundation walking program is a really great service. It's walking groups. As I said earlier, doing something that you enjoy and doing it with other people. So if you think I haven't got anybody to go for a walk with, call the Heart Foundation walking program and they'll find the nearest walking program to your area. Don't forget to use your GP, have a health check, and identify problems early. Don't put it off. Do any cancer screening. When that little box arrives in the post, sometime close to your 50th birthday the first time, so that's a real thrill, do that. It's really, really important. Getting on top of cancer, all kinds of cancers can be treated and managed quite well if they're picked up early. Have your flu injections. Keep on top of other injections that don't, for the vaccinations that don't provide lifelong protection. And particularly if you're becoming a grandparent, check out what vaccinations you should have. You don't want to be the grandparent that gives your new grandchild whooping cough. Talk to your GP, particularly if you've got a chronic disease, about linking into a care plan that can allow you to access some allied health sessions with whether it's a podiatrist or a dietitian, an exercise physiologist, whatever you might need to support your health. And of course, use whatever services veterans provide, such as Open Arms or other mental health or physical health services that are available. And finally, if I can just quickly talk about websites. As I said at the start, you need to know what you should be doing before you can start to make healthy changes. And the web is a wonderful source of information for, well, pretty much anything, really, but it is also a source of huge amounts of incorrect and totally bizarre and ridiculous information as well. So if you're going to the website to look at things that you can do for yourself and get that understanding that you need, stick to websites that are reliable. Government health departments, doesn't necessarily have to be SA Health, it might be Queensland or Victoria. Good, sensible, reliable, correct information. We've just launched an across-government website that was put together as a response for COVID. So there's information about all kinds of things around COVID that you might need to know. But there is also quite a lot of health information. There's loads of videos around cooking, being active. There's a series of videos that demonstrate how to use that outdoor fitness equipment that's in the parks that you're hardly ever seeing anybody use, which is because they don't know what to do with it once they stand on it. So really good information on the Open Your World website. The SA Health website is also pretty good, but a little bit more difficult to navigate around. And finally, use the reputable NGOs. The organisations that you've heard of and that you know of, like the Heart Foundation, like Cancer Council, like Diabetes Australia, they're like governments. You're going to get the right information. It will be helpful information. They can direct you to other services and programs, tell you what's available, rather than some of the other wacky things that you might see come through on your Facebook feed. So I think that's just about it from me, and I think I'm up for some really simple, non-tricky questions. No? Cool. Excellent. No, good. Okay, thank you.
So thank you, Lyndall, and please join me in thanking Lyndall. In the spirit of wellbeing, I know that that we've got a bit of a break now for about 10 minutes, so you can get your 250 steps for this hour. With what Linda was just saying, we'll have links to the Open Your World and the SA Health website, particularly the more easily navigable parts, on our website in the next week or two, and we'll send you an alert when we've got our complete suite of information up. So my watch says that it's 18 minutes past 4, so we have 7 minutes before I would ask that you're all seated again, ready for the Premier's arrival. Now, we did receive a number of questions ahead of the forum today. You've been writing, I can see that there's lots of people who've been writing questions on your cards. Please use the next 7 minutes to give them to the team at the back. We'll definitely be going through some of the pre-submitted questions, and if the Premier's got time, we'll take these, but if not, I assure you that there will be answers on our website in the next couple of weeks. For those who are looking on the live stream, you can submit questions that we'll be providing answers to on our website on Veterans SA at sa.gov.au, and you will now see a holding screen until we come back on closer to 4:30. So please be seated at 4:25.
the matter here? I'm waiting, son. Waiting on Roosevelt. I'm waiting on Roosevelt. The rent was due and the lights was out. I said, tell me, mama, what's it all about? We're waiting, son. Waiting on Roosevelt. Just waiting on Roosevelt. My sister got sick and the doctor wouldn't come because we could not pay him the proper sum. Awaiting. Waiting on Roosevelt. We're waiting on Roosevelt. Then one day they put us out of the house. Ma and Pa was meek as a mouse, still waiting. Waiting on Roosevelt. Still waiting on Roosevelt. When they felt those cold winds blow, didn't have no place to go. Pa said, I'm tired of waiting on Roosevelt. I can't get a job, I can't get no grub. Backbone and navel's doing the belly rub. I'm tired of waiting on Roosevelt. Tired of waiting on Roosevelt.
Good afternoon, everyone. It's that time again to be seated, please. It is now 4:26 by my watch. If you would all like to please take your seats. So I'd again like to take this opportunity to thank you for your attendance today, both here in person, and we have almost 20 people who are viewing our live stream, so thank you for attending. And your continued interest in supporting our shared community ensures that topics and issues relevant to the community are brought to the attention of the agency and the government. So I hope you found that the discussion panel on the homelessness sector and the presentation by Lyndall from Wellbeing SA really informative, and that you've gained some useful information on the many services available to the South Australian community that our veteran community can also access. And without further ado, it is my absolute privilege to welcome the Hon Steven Marshall MP, Premier of South Australia and Minister for Veterans Affairs. So please welcome the Premier.
Thanks, Catherine. I was just going to sit down and have a little rest, but there's no rest for the wicked, that's what they say. Can I begin by acknowledging that this afternoon we're meeting on the traditional lands of the Kaurna people and that we acknowledge their ongoing spiritual relationship with this precious land. Can I most importantly acknowledge any veterans who are here with us today, any serving men and women of the ADF, and acknowledge their service and their sacrifice for our nation. We are a very grateful nation. It is my pleasure and privilege to serve as the Premier of South Australia and have also the portfolio responsibility for Veterans Affairs. Before I address your questions, I would like to provide an update on a number of matters that I, the Veterans Advisory Council, ex-service organisations and other groups have been addressing over the past 12 months. But before I do that, I would like to again say thank you to the veterans in the room for your service. I know the military are not fans of public acknowledgements, but I hope within these walls you will accept my thanks and my gratitude on behalf of the people of South Australia for your service to our nation. I also thank the families of our current and former serving women and men. Without their support and love, Australia would not have the world-class modern military of today, and our South Australian community would not benefit from the skills, experiences and dedication of our military veterans every single day across our great state. Our veterans and their families play a vital role in South Australia's community. My government is committed to providing a strong framework and strong support to veterans and to their families in conjunction with the federal government. We recognise their service to our nation and the skills and attributes that they bring to our workforce. Veterans SA are working to identify barriers to employment for veterans across several of government's key priority sectors such as defence, the defence industry, agriculture and tourism. My agency is also working with Defence to improve the translation of military skills and identify education and training pathways to align with the state's infrastructure, employment and growth sector strategy plans for the next decade. This will ensure that state government departments are well informed about the skills and attributes of veterans and their families, and that the South Australian Public Service can become an employer of choice for those with military service. As you would all be well aware, the final report of the Productivity Commission, Compensation and Rehabilitation of Veterans, was handed down in June of last year. The Veterans Advisory Council wrote to me outlining concerns about some of the recommendations and support for other of those recommendations. These observations were passed on to Minister Chester at the Veterans Ministerial Council meeting, which was held in August last year. Last month, the Australian Government released an interim response to the report that addressed 25 of the 69 recommendations. 17 of the 25 recommendations addressed in the interim response have already been implemented, are underway or will be delivered. Of note, the federal government have rejected the recommended changes to gold card eligibility outlined in the report. A joint transition authority within Defence will be established to provide better transition for ADF personnel as they move back to civilian life. The full response can be found at the Department of Veterans Affairs website. I'll continue to work with my colleagues on the Veterans Ministerial Council to ensure that the interests of the South Australian veterans community are heard and are considered. And I'm encouraged that many of you took the opportunity to have your say either through the Veterans Advisory Council, individually or collectively through an ESO collaboration. SA Health is now working with Veterans SA, Wellbeing SA, and both the Veterans and Veterans Health Advisory Councils on the development of the $5 million Veterans Wellbeing Centre at the Repat Health Precinct. Collaboration between these portfolios will make sure that this is a usable space for the community. The Wellbeing Centre will provide a safe and welcoming environment in which veterans and their families can access services and feel confident the support they need to improve their health and their wellbeing. The chapel, the Remembrance Garden, the museum and the SPF Hall will be protected and preserved as community assets, acknowledging their history on this site. The centre, which is anticipated to open in April 2021, will provide access to a range of health and wellbeing programs such as counselling, advocacy services and also group activities. In July 2019, I committed to the development of a master plan for the Torrance Parade Ground. This was completed in June 2020. Today I'm delighted to announce $1.2 million over 2 years in this year's budget to be handed down next Tuesday to upgrade part of the Torrance Parade Ground precinct. This initial investment will improve accessibility and amenity of the precinct for the veterans community and aims to attract more South Australians to the heart of our state's proud military history. To improve the utility of the drill hall for a wider variety of activities, semi-permanent dividers will be installed. This means more events can be held concurrently, bringing more people to the Torrance Parade Ground. It also means that smaller activities can be held in more appropriate spaces. Upgrades to all kitchens and bathrooms will be undertaken to bring them up to an acceptable standard. Provision of smaller bookable spaces will make it more affordable and more viable for ex-service and civil service organisations to use these fantastic facilities. Additional discrete storage space will also be added to the facility for storage of chairs, tables and other items that are currently being stored in rooms that can be converted to offices and more useful spaces. Freeing up this space offers a broader range of options for tenants and organisations interested in the usability of this site. This work is being undertaken by the Department of Environment and Water in 2021. My intent remains for the Torrance Parade Ground Precinct to be a busy place with veterans at its centre. Veterans SA will continue to consult with the veteran, cultural, education and arts communities to increase the usability and to also raise the profile of the precinct. As the Torrance Parade Ground is the heart of our memorial precinct, the 45 memorial plaques that are situated along Anzac Highway will now be relocated to this precinct. It has been determined that the location of the 45 memorial plaques along Anzac Highway median strip is not safely or easily accessible by the South Australian community. Veterans SA are working together with Legacy, RSL SA and also the Marion Council to achieve the relocation. It is expected the plaques will be relocated by June next year. Emerging from a decade of significant commemorative activity, Veterans SA, led by Catherine Walsh, are taking the opportunity to develop a long-term strategic outlook for the role of the state government in supporting those who have served and also for their families. This is an important piece of work and I encourage everyone in the veterans community to have their say in where the focus of Veterans SA should be over the next decade. This work must be informed by the needs of the community now and across the next 10 years. In Adelaide and in regional South Australia, for our older stewards of the veterans community and the up-and-coming leaders with more contemporary military service. Discussions with Veterans Advisory Council have concluded and wider consultation will be undertaken over the next few months and early into the new year. Veterans SA have planned a number of opportunities to consult with and hear from the veterans community. If you would like to contribute to the co-design of the strategic outlook, please contact Veterans SA or talk to one of the team who are with us here today. Can I say thank you to each and every one of you for attending this afternoon, and most importantly, thank you on behalf of the people of South Australia for your service to our nation. Just before I do open up for any questions, which I will attempt to answer, and if I can't answer them, I promise I'll get back to you as quickly as I can. I do want to acknowledge that, of course, this has been quite a different year for us, quite a different year for the veterans communities. We've tried to live and adjust with the coronavirus. It's meant change to many of the activities of the veterans community, whether it be from a commemoration perspective or from a service level provision. I want to thank everybody for being flexible during this year. I think that we've come to really welcome and to create great value from many of our commemorative activities in South Australia, and these had to change. These had to change with what happened with the coronavirus. I'm hoping that we can get back to a level of normality very soon, but where we have had to adapt, I hope that we've been able to provide an appropriate commemoration for service right across this year. But for many different events, very important events across our calendar, we've had to necessarily reduce them in scale, size, and in some cases postpone or cancel and move often to a different format. Sometimes that format has been something which has in many ways been an enhancement, I think in particular of the dawn services or the commemoration which occurred at the base of driveways right across our state and nation. Now, I don't know whether this is going to continue into the future. Oh, Cheryl Cates is nodding, so yes, it's going to. I hope it doesn't diminish from the dawn service that we have here at the National War Memorial on North Terrace and the other services that we have. But it is true there are lots of people with very young families who have found this very useful, and there's also people who have got mobility issues or who don't want to travel distance at that time of the morning. So there's a practical example of something which I think may become something for the future. It's come out of a very difficult situation, but it's like so many other aspects of life. So far in 2020, we learn, we adapt. Sometimes we actually improve through that process as well. So enough for my opening remarks. Can I now throw it open to you for any questions or queries, suggestions, concerns that you... Oh, no, Catherine's coming back up. Did I say the wrong thing? No, you've got a microphone. Okay, so if you've got a question, Catherine will...
Yes, thank you, Premier.
Yes.
And can you join me in thanking the Premier for his presentation? And it's quite fitting if I can just reflect on your remarks, Premier. We are sitting currently in the drill hall, which is hallowed ground and steeped in great history. And so, so thank you for the announcement around some of the improvements here, so we can bring more veterans and the South Australian community here over the coming decade. So, Premier, we do have a live stream. That's what the gentleman up the back is doing as well.
I
and
wondered what he was doing. Hello.
And we have received a number of questions ahead of time, and we've also got some questions from the floor. So I'll ask them to you, and then you can respond. Okay. Excellent. All right. So the first question that we received, by way of some background, the ex-MRC, or the ex-Military Rehabilitation Centre in the northern suburbs, as we know, was tragically devastated by fire. Pat Campbell and Dion Cowdery, who's here today up the back, and the team have done some really good work over many years. So as Minister for Veterans Affairs, can you advise if there is anything that can be done to assist the reconstruction of the facility?
Thank you very much for the question, and actually, as I walked in, Peter Sahaki, is that how we're saying it? Oh, I knew I'd stuff that up. Gave me a letter on behalf of the people who use that centre. It is something which is very much valued. It's a centre that I haven't visited. I wanted to visit it earlier in the year to get a better appreciation of it when I heard the devastating news that there had been a fire. My understanding is that there's an investigation underway, and Defence will tell us what they're going to be doing going forward. Peter said that there's been some issues in terms of trying to have input into that decision making. We certainly want to do two things. One, when we find out what Defence's focus is going to be there, whether or not there's a role for the state government. But secondly, I think it fits into a broader body of work that we need to do to work out what services we need to, at the state level, be providing across South Australia. We've got services in the south, we've got services Glenside and in the centre, what have we got out north, what do we need out north, and I'm thinking that the XMRC will probably fall into that. So I think there's two things. We've got to first of all find out what the feds are going to be doing with that site and how we can fit in, but secondly, whether or not as part of that we might be able to put some state government services into the north where we know that there is a large population of veterans. So Peter's given me a letter. I haven't had a chance to read it. I will read it. And I would like to get out and just to eyeball it. As I said, I apologise. I said that I wanted to do that a couple of months ago. This has been a year where quite a lot of things have, unfortunately, with COVID, slipped. But I absolutely commit to getting out there as soon as I possibly can.
Thanks, Premier. Question number 2.
Yes.
I feel like it's a bit of a game show, Premier.
Okay, first in with the buzzer.
Question number 2. What is the government's plan to provide ongoing crisis support until stable accommodation can be found for veterans?
Is this a homelessness question or...?
Yeah, so yes.
Yeah.
And we had the homelessness panel earlier as well, Premier, with some experts from the sector.
So can I just say, look, this is an issue which there are two parts to it. On the one side, there's the crisis support, and on the other side, there is actually trying to develop a longer-term, more strategic and sophisticated approach to end homelessness. And I think the focus of the government for a long period of time has been at that acute level, so trying to get people into emergency accommodation for short periods of time. And what we're trying to do now is to work to understand the individual, what their unique needs are, and try to end homelessness. COVID has been a really interesting time for us. We've spent more than $7 million as a government trying to house people that are experiencing homelessness during this period. We ended up identifying far more people that were experiencing homelessness than what the previous surveys were telling us. So you could look at this as a negative or as a positive. I look at it as a positive because when you know the cohort, you've got a better ability to actually address it. And so what we found is when people were put into that emergency accommodation in hotels during the real midst of that, difficult period with COVID, we were able to identify, learn more about them and actually put some better wraparound services about them. This wasn't 100% satisfactory and there's still a long way to go. But what I can say is that as a government, our budget now for addressing homelessness is in excess of $70 million per year. But most importantly, we've just put $20 million into sort of preventative programs. So really trying to look as strategically as we possibly can about the reasons why people are experiencing homelessness and the things that we can do to make a permanent change for that individual. So there's some of the things that we're doing. I think also we're trying to move away from a series of sort of stovepiped NGO provision of services to, if you like, a more statewide, coordinated approach. Our goal is to end homelessness in South Australia. I think a place like Adelaide, a country like Australia, we should have that as our goal. It's not easy. You can't just do it overnight because they're often very complex issues that you can't just have a cookie-cutter approach to dealing with this issue. But certainly, from our perspective, we have got we've got a goal, we've got an objective, we've got a really, I think, committed NGO structure in South Australia to help and work with us on these problems. We've got a good base budget, but most importantly, we've got a focus on the preventative side. So it would be very interesting for us to be able to present a bit of a report on that again next year on how much progress we've been able to make on that front.
Thank you, Premier. Also, as part of our homelessness panel, we had the CEO from Catherine House, Linda Matthews, and I preface that for the question that you're about to receive. So, by way of some background, it's been suggested among concerned veterans that domestic violence is an issue within some Defence Force families. Now, due to regular postings, partners could be more likely to find themselves without support networks. So the question is, what can the South Australian Government do to gain visibility of domestic violence abuse within the service community and to provide support to victims? And then that's the first part. And then could the Women's Safety Services SA be asked to collect data about military spouses who are affected by domestic violence?
Yeah, look, this is a big issue. On coming to government, we appointed an assistant minister with responsibility for prevention of domestic and family violence as a dedicated role. So because we appreciated that there's not one minister that's responsible for this, there's multiple cabinet ministers that all need to be working together in a coordinated way. So we appointed Carolyn Power, who's the member for Elder, to look at this. Again, you know, there's two parts to this. One, you've got to have the acute services that are ready for there. So if somebody does find themselves in a situation that you can provide that immediate assistance. And certainly since coming to government, we have increased the provision of places and services, and also listened to what the community was saying about perpetrators as well. It seems slightly counterintuitive, but sometimes what the sector tells us is best practice is to provide accommodation for the perpetrator rather than the victim, because in many ways it's better for the victim if the victim stays in their own house with their family and where the kids know where everything is, and take the perpetrator out and work with the perpetrator. So although this did alarm some people and not everybody was happy that we were funding homes for perpetrators, I think this genuinely is best practice. It's still early days and that's underway at the moment. We have, I think it goes without saying that when it comes to domestic and family violence, we have a zero tolerance policy. It should not occur. But we have a responsibility as a government to make sure that we're putting the support services in place to help people who are experiencing domestic and family violence, but also those people that are susceptible to committing domestic and family violence. And to that end, we have put a lot more effort into helpline for men who might be experiencing anxiety and be very that they've already personally recognised that this could be a problem for them. So we want to put more supports in there. One of the other things that we've done, and I'm not 100% sure what this service is called, but we're allowing partners who suspect that their partner has a history to make a confidential investigation to try to find out their history so that they can be better informed and not find themselves in a similar situation. We've also developed an app which people that are living in a dangerous situation can use very discreetly to get help, which is again something that we've been focusing on in terms of that identification of best practice that exists in other jurisdictions and bringing it to South Australia. In terms of the second part of your question, which was about the women's safety services, they are doing they do collect data, and I'm more than happy to ask them whether or not they can collect detailed, or maybe not details, not the right, but collect the data as to the veteran status of the victim and the alleged perpetrator, so that we can have better data. Obviously, you know, that has to be completely de-identified, otherwise nobody's ever going to actually provide it. But the Women's Safety Service in South Australia is outstanding. It's nationally recognised on COAG, which has domestic and family violence as one of only 3 subcommittees for the whole of, and by the way, one of the other 2 is veterans' wellbeing. But domestic and family violence is one of the standing items for COAG and now the National Cabinet. And South Australia is very well regarded, to the point that Maria Hadgis from the Women's Safety Service in South Australia is the one who presents to COAG. So it's an honour that South Australia is selected as the lead in this area, and she's got her finger on the pulse right across the nation. We've got a long way to go in terms of providing the right level of services. This year we've been focused on providing more accommodation, especially in regional South Australia, and we've got a commitment at the moment to provide 40 more sort of crisis accommodation opportunities. But as I said, one of the things that we need to be focused on as much as possible is that prevention side, and putting money in to support national approaches as well as our own state-based response.
Thank you, Premier. And you've mentioned a number of websites and services in the app. So we are having a website, one of our pages on our website will be dedicated to this town hall and some of the answers that you've provided, and also with the live stream. So we'll make sure that all of those links are available to anybody who wants to investigate that some more. So thanks, Premier. Premier, as you know from the community, and I look around here and there's a number of people who have recently transitioned from the ADF here in South Australia. Transition is a topic of great interest at all sectors of government, and we've received many questions around that, particularly transitioning into civilian life. So the question is, what is the state government's role in transition from the ADF into civilian life?
I feel like I spoke about this last year and I spoke about it the year before, and we're still talking about it because we've still got a long way to go in this area. I think it's one of the areas that the Productivity Commission report actually focused on, that we are not doing anywhere near as well as we should be as a nation. We have men and women serving in the ADF. They are well educated, they are challenged when they're in, they have got good skills, and many of them leave the ADF and then find themselves unemployed or underemployed, and both of them are a problem. Because you have somebody who is used to a pressure situation, an action-packed situation, a high level of teamwork, and they find themselves underemployed doing something which, quite frankly, is well below what they're qualified to do, can lead to the exacerbation of a whole pile of other conditions. And so we recognise this here in South Australia, and the federal government have recognised it through that Productivity Commission report. The recommendation that was in there was really to establish the joint transition task force, I think it was called. That's only just been formed, and that's got a lot of work to do. We in South Australia don't want to compete with that. We want to sort of work in with that joint transition task force, but we also want to push them along. We've had a couple of false starts ourselves in South Australia, where we thought that there might be an easy way for us to try and match up opportunities and veterans, and although there's been some limited success, I think there's much more that we can be doing in that area. One area that I have been speaking to the federal government about, the Defence Minister and also the Veterans Minister, is the issue of the cyber world post-service. One of the fastest growing sectors in the world at the moment is around cyber security. There's a lot of, whether it be the local government sector, whether it be state government, federal government, larger corporates, there is more and more attacks and threat on our digital assets. And you'll see a lot more about this. You might have heard the Prime Minister speak a few months ago about unprecedented level of attacks on our data in Australia, and he did this for a very important reason. He did it very deliberately to put Australia on notice that you know, the cyber attacks and the cyber risk is growing, and it's not going to move back. So we've also identified that as a nation we've got a massive shortfall in terms of cyber skills to counter this threat. One of the opportunities is for ADF personnel towards the end of their service to acquire cyber skills, so that as they make the transition to civilian life, they keep their security clearances in place, which can lead them into very good quality jobs within the defence industry. Defence industry is keen. The ADF is keen. We have said from South Australia's perspective we would be happy to design the programs and fund it out of the state level, because we would like to make this a focus for us here in South Australia, because we think there's really good, well-paying, meaningful jobs that really suit people who have served our nation, people that are on Australia's side to go into this area. And so whilst you know, I haven't got anything to announce today, what I can say is those types of opportunities are things that we've been working on, but we will definitely work in with that Joint Transition Committee. It's an area where we have to really lift our game, and we want to play our part in that here in South Australia.
Thank you, Premier. You mentioned this in your presentation, and there's a lot of interest, obviously, about the Veteran Wellbeing Centre at the Repat down at Door Park.
Yes.
And so the question is, what health facilities will be built and be available for veterans at the reactivated Repat site?
Okay, so the Repat site is really, you know, as people where it was sold off, we were able to change that when we were elected, and we want to turn it into a genuine health precinct. It won't be completely veteran specific, because the advice that we've received from the health professionals is that veterans' health issues are also, there's some which are specific to veterans, but there are many which are mainstream, and to get best sort of service and care for veterans, the vast majority of services do need to be in that mainstream arrangement, and also just from a geographic perspective, you know, you might have people, veterans living out north. There's not a lot of logic in heading all the way to the Repat to have an appendix taken out when they can have that at the Lyell McEwen. It's sort of split like that, but we do want to turn the Repat site into a genuine health precinct again, and so there's a lot of services which are going on there. But we also want to, if you like, commemorate the history of the Repat site and the very integral role it's played for our veterans in the past, as well as having some specific, if you like, services that are on that site. So in terms of some of the commemorative things, obviously the Remembrance Garden and the chapel and the SPF hall will be preserved in perpetuity down there, and we know this is very important to our veterans community. In addition to that, we will have the Veterans Wellbeing Centre located down there, and the last advice that I've received is that that will be done in April next year, and so that will provide a range of services and opportunity for veterans communities to get together. But as I said, it's not just about veterans down there. There will be broader focus down there. It's going to be a national centre of excellence in terms of dementia care. And it's going to have a really fantastic capability in terms of head and spinal injury rehabilitation, and we just announced only last week another $6 million which is going into a step down facility on that site for people who are doing that rehab. We think that there can be lots of crossovers between the veterans community and those other services, because you've got good, you know, hydrotherapy opportunities down there, pools and other facilities, health professionals on that site. And the other point that I would say is there's still things that we are working on. So we haven't made final decisions about what is going to happen with Doorhouse. We haven't made final decisions with regards to what is going to happen down on some of that very easterly end of the Dawes Road frontage. The work is being done at the moment on wards 1 and 2, and I'm advised when I was down there the week before last that that will be completed before the end of the year. And there's also quite a significant amount of what we would call transitional care beds. So these are people that have been in an acute bed in a major teaching hospital. They're not in a setting where they need to have the highest level care, but they're also not in a position where they can go back into the community. And the Repat is, well, it's, you know, a very attractive place. You know, people that are visiting can pull up out the front. They don't have to go up to the 7th floor to visit somebody in a building. They can pull up out the front. They can walk around the gardens with people, and it's very conducive to that sort of healing. And so we think that this is a perfect site to decamp people from hospitals, give them an experience before they go home. We're also in the final stages of working out what type of surgery goes back onto this site, and this will be a combination of surgery which is provided in terms of state services, but also private services. And so we need to, as a state, have like a flex capacity, because sometimes our hospitals get very busy, and so you don't want to be doing elective surgery, taking up those theatre hours, doing maybe some orthopaedics or urology work that could be done elsewhere. And so we want to be able to, on that Repat site, have a capacity that will be you know, at a certain level on a weekly basis, but if we need to decamp work from our major teaching hospitals there, we can flex that up. So the final work on that is being done at the moment, but I haven't got anything to announce at the moment.
Thank you, Premier, for that very comprehensive answer.
Do you think my answers are too long to all the questions?
No, not at all.
Some people say I talk too much.
I was not one of those people, Premier. So I'm conscious it is 5 o'clock, and you do have to go to your next
already
commitment.
Well, yes. What about questions from the floor?
So we've got some questions that we've received from the floor, but a lot of them were related to what you've already covered, because there are a number of topics of interest, and we're also happy to take any questions out of session that I'll make sure that you can answer. Or you will answer. Sorry, that was the wrong.
I'm very happy to, if I have to go. Do I have to go right this second? Goodness, I've got the Italian ambassador at 5:25. Is there one question that anybody's got, or comment or query? Yes, sir.
So I'm an advocate at the Veterans Centre.
Yes.
I've got 5 mentees, people I train.
Yes.
We are going to be an anchor tenant at Plimpton at the Repat.
Oh, excellent.
And DVA has basically put a hold on consolidation and assessment training. So we've got several of our trainee advocates are now in limbo. They don't know what's going to happen. Several of them have actually not left the program but are thinking about it. I actually did a DVA course during the COVID process through Open Arms, and there were 3 DVA delegates on the course, but as far as DVA is concerned, there is to be no face-to-face training. I just want to know, it's just double standards, and I've posed that question up the chain, and I'm just asking you.
Well, I'm more than happy to follow that up with DVA. Sometimes what happens with COVID is, you know, people make national decisions. I was just talking to the head of the Commonwealth Bank, saying, can you send your staff back to work in South Australia? But they tend to, sometimes national organisations and governments make decisions about COVID. We're not doing face-to-face, we're not doing this, we're not doing that. But in South Australia, because we have done well with the coronavirus, I think we are all getting back to a type of normality at the moment. So I'm happy to speak to DVA. I don't know much about that exact issue. This is one of the things that we've got to get right when we do the review, the strategic review with Veterans SA. What should Veterans SA be doing? What should DVA be doing? What should we be doing in that Venn diagram as the intersection between the two? What are the things that I need to be sort of advocating for with Darren Chester? What should I be advocating for on the National Cabinet with this Veterans Wellbeing Subcommittee, which is going to be on it? I was absolutely delighted when the Prime Minister said that this was going to be one of just 3 areas for the National Cabinet. But I'm certainly happy to follow that up. I'm sorry if we have run out of time, but I don't want to create a diplomatic incident. But can I just say, I sort of probably have to apologise a little bit because although this is like an extraordinarily important portfolio, I feel that, you know, because commemorations have been postponed or cancelled or scaled down, I haven't met as many of you this year as I have in previous years. And I think now that we are getting through that, you know, the last 6 months have been a really tough year trying to get everything in place. I do feel far freer now than what I was feeling in April and May. So I would really like to make sure that I can engage with as many of you again as quickly as I possibly can. And can I just say, if there are things that you think that I urgently need to get onto, don't hesitate to get in touch with my office. You can either go to Catherine, of course, or Chantel, or any of the fabulous team at Veterans SA, but also you can just go directly to me through my office and Beck Astley, who's here with me today. So again, thank you very much for coming along. I hope you found the program that's been put together helpful, and if there's anything compelling that people haven't felt comfortable about raising in front of everybody else today, don't hesitate to come directly and follow it up. Or if after you leave you think, oh, I wish I had have asked that guy about this, that or the other thing, make sure that you give me a call. Thank you very much.
Well, thank you, Premier. So, Premier, on behalf of the South Australian Veteran Community, I'd like to thank you for your time this afternoon. As I mentioned, we are live streaming, which is a first for Veterans SA, and hopefully a progress that we can incorporate from here onwards. And that way that the information that you've shared today is accessible regardless of geography, and this will also be available on demand for those who've missed it or want to see your presentation again. So if you'll all join me with thanking the Premier and now, ladies and gentlemen, that does conclude this year's Town Hall. We have taken the cards that were availed to us earlier in the day. If you've been writing more questions, either for the Premier or for anyone on our homelessness panel or for Wellbeing SA, then please provide them to the team on your way out. You're also welcome to email us at any time on veteranssa@sa.gov.au, and over the next week or two we'll be putting the answers to the questions up on the website, along with the link for this live stream and the other links and resources that we were talking about. And then finally, finally, as with all good continuous improvement projects, we have done something a little different today, and so we would welcome your feedback, and we'll be sending out an evaluation form electronically next week with only a few questions, just a few minutes of your time, and we'd really appreciate some feedback on what was great and what we can improve for next time. So with that note, thank you everyone very much, and pleasure seeing you.